Doctors have various methods of treatments that they recommend to their patients, but you might not have heard of hyperbaric oxygen therapy, and it could very well improve your health. Here to elaborate is Dale Harold, Technical Director of Operations for Desert Hyperbaric Medicine. Dale, welcome to Desert Living.
Thank you for having me.
Welcome back, I should say.
Thank you so much.
What's hyperbaric medicine?
Hyperbaric oxygen therapy is 100% oxygen breathed in a decompression chamber. Full body goes in, they lie in there, and what they feel is a little pressure in the inner ears. We take them down in atmospheric pressure, and they just simply breathe.
That sounds beautiful. It sounds very relaxing.
It is relaxing to some, and some of them have the anxiety of being in an enclosed chamber, but at the same time, we have different techniques to relax them and keep them comfortable once they're in the chamber.
Well, what appeals to me is that it's not like a typical hospital machine that it's all enclosed. You can see here, I mean, obviously it's enclosed, but it's glass.
Exactly.
So you can see other things, so it's kind of like you're in open space almost.
Exactly. A lot of them lose focus of being in the chamber. They may fall asleep and then come back, and it's really clear glass, so it's not like it's a steel chamber that they're in. They can't see out. They can see all the way around 360 degrees, so that's very relaxing to know as well.
So we have a picture right here.
Yes.
This is the chamber itself.
That is
correct.
the actual chamber.
And so you can see there that it's clear.
Totally clear.
And is it also called, what's the nickname? Is it HBOT, is that right?
Some of them call it HBOT, you know, the initial hyperbaric oxygen therapy. So when they go online or research it, they pull up, just put in HBOT, hyperbarics will come up for them. So yeah, we shorten it by saying HBOT.
I like it, it has a nice ring to it, HBOT.
Yes. HBOT, exactly.
And what are the health benefits to HBOT? Well,
what hyperbarics is used for is healing. So any part of the body that's been broken down and need to heal, you go into, the way your body's going to heal from the 21% we breathe every day is, that's the healing that you're going to get from that. We increase it by 100%. It's pressurized, so it works through the skin, absorption, through the bloodstream. Everything's being supersaturated with 100% oxygen, so that promotes healing.
One of my favorite pastimes is hot yoga, and I do it obviously for the exercise, but also it supposedly relieves toxins from your body. So does HBOT do sort of the same thing?
Exactly. It relieves it, pushes the toxins out of the system. It supersaturates the cells, the tissue, the hemoglobin. So that's what's carrying the oxygen throughout. So it's going to get the impurities out of your system as well.
Basically, I don't have to torture myself anymore with the hot yoga. I can
No,
just
you don't. You can come and lay in this chamber, relax, take a nap, watch a
movie. Watch a movie.
Exactly. Watch a movie and just relax.
Does Medicare or private pay insurance?
Yes, there's 15 approved indications that Medicare and private insurance reimburse for this treatment for. You fall under those guidelines, and it is reimbursable.
Okay. And talk about before, after, or let's go before, during, and after the process.
Well, before a patient would come in, they would see our medical director, make sure they're a healthy candidate for a hyperbaric oxygen therapy.
Okay, so you have to be pre-screened, you can't just...
Yes, no,
okay.
you would just walk in, because 100% oxygen at the levels that's delivered in a hyperbaric chamber is a drug. So that's why there's thresholds, there's protocols that we use, and there's the different times that you would stay in the chamber for, depending on what we're treating you for. So it being a drug, we want to make sure you're going to be a safe candidate and be able to tolerate the actual pressure and the 100% oxygen once you're in the chamber.
During the process itself, are my ears going to pop?
Yes.
As normal?
The initial pressurization, it's normal to have pressure in the ear, so you're going to feel the pressure, and what you're going to feel is like driving up in the mountains, being in a cabin of an airplane when they pressurize the cabin. So you're going to clear your ears. There's different techniques that we show the patients how to do. They clear the ears as we're slowly taking them down, and they relax. Once we get them down to what we call the treatment depth, wherever we set the machine or where it may be, they clear their ears. Once they get there, it's just like it is out here now.
And then afterwards, me or let's say a viewer will be feeling great. Is that right?
You come out, we like to
smiling.
Yeah, smiling more.
All the nerves are gone.
Exactly.
Just feeling great and happy and oxygenized.
That's
oxygenated.
Right. Hyperoxygenated is what we call it. So once they come out, they feel much better. A lot of our patients' voice feeling much better, energy level up. So everyone gets a different sensation from that.
All right. Well, if you'd like to learn more about the Desert Hyperbaric Hyperbaric Medicine, you can visit their office in Palm Desert, give them a call, or check out their website, deserthyperbaricmedicine.com. Thank you so much, Dale, for joining us today. I'm looking forward to trying out the chamber myself.
Absolutely.
Don't go anywhere. We'll be right back with more Desert Living.